I actually did a survey that hopefully will be published here soon.
Nice.
There were about 400 dental professionals that took it. And those that self-reported that they were an infection control coordinator had higher compliance rates in this whole list of things we asked them about. So just across the board in every infection control domain, they were doing better.
Sarah Stream has been a dental clinician for over 18 years. Her love for helping dental professionals understand and implement infection control practices has led her to become the mastermind behind some of the greatest educational resources around safety in dentistry. Sarah's an infection preventionist for the Nebraska Infection Control Assessment and Promotion Program, an ADS Emerging Infection Control Leader Award winner, and the current education product manager for the Dental Assisting National Board, otherwise known as DANB. In today's episode, we discuss the importance of data and how you can use it to make informed and effective decisions, especially around infection control. We unpack the power behind continuing education and staying curious as dental assistants, and why every dental assistant should invest in their ability to lead and advocate for what they believe is critical to patient safety in their office. Please join me in welcoming Sarah Stream to the Safer Together podcast. Sarah, how did you get into dentistry?
Oh gosh. Dentistry is like one of those great things in life that just kind of fell in my lap. And so I started off, like when I graduated high school, I wanted to go to school to be a forensic pathologist.
Whoa.
Yeah.
Wait, tell me what is that?
So that is like a medical examiner.
Okay, cool.
Yeah. Yeah.
Wow.
So I'm really into like the whole forensic stuff. But kind of in the middle of all of that, life happened. I had to move home and find a career that I could start right now.
Yeah.
So saw a commercial about dental assisting school.
No way.
And we can start in 10 weeks. And I was like, let's do that. So started classes for dental assisting and absolutely loved it.
Wow.
And got into clinical dental assisting and just kind of grew from there.
I don't know if I've ever seen a dental commercial for like...
This is a long time ago. This is a few years ago.
That's so cool.
Yeah.
You mentioned, what was the thing that you were interested in prior?
Forensic pathology.
Forensic pathology.
Yeah.
And it's funny because as I've kind of researched up on who you are, you've really taken your love still for the forensic part of dental. It feels like you're such a data-driven person.
Oh yeah, absolutely.
And so tell me a little bit about how you've almost married the two loves, data and dental.
So data is not something that you hear commonly in the dental space at all. And that it really plays into the public health side of things as well, and epidemiology. But there are a lot of opportunities in dentistry to look at the data and create better systems and better outcomes and prevent harm and just all kinds of fun things you can do with data.
Yeah, yeah. And that's kind of led you into, it feels like kind of that infection control space. So tell me a little bit about not only diving into the data, but navigating into this particular field of infection control within dentistry.
Yeah. So after I graduated for dental assisting and worked clinically for a while, I capped out really quick as a dental assistant because, that's what happens in dental assisting. So I got into education and became a program director for a dental assisting program and taught for a little while. And it was really apparent then that the infection control part of that program was lacking. Not only for the dental assistant side, but for the hygiene side, there just wasn't a whole lot of substance to that part of the program. So I really tried to beef that up. And then I had a really good friend who said, she called me up one day and she was like, I'm going to get my master's of public health degree. You should do it with me. And I was like, all right.
You're like, all right, let's do it.
Let's do it. So we did it. She went into healthcare administration, which is totally not my thing, but they had an epidemiology track. So that was the path that I went down. And that really just cemented the data part of things for me. And then after that, the pandemic hit, which was total disruptor for a lot of people's lives. And where I was working at the time, it was not pandemic friendly.
Yeah. Yeah. Oh man.
So I saw an ad on Indeed for infection preventionist, and I was like, that would be so cool. It'd be so much fun to be an infection preventionist.
Yeah.
And when I interviewed for it, they were like, we're actually looking for somebody that has experience in dentistry.
Wow.
I was like, well, here I am.
Yeah. Yeah. It's like, I'm that person.
Yes.
Yeah. Wow. So tell me, since diving into that space, what are some data points or insights that you feel like it's like if every single person in dentistry could know these things, this would be so valuable for us to understand?
Well, there are a lot.
Yeah. I know I'm putting you on the spot. I'm like, top 3. What are the top
three?
3?
Okay. So I've done a lot of infection control, like mock inspections for offices, and we would collect data on all those. So, we would have a checklist. Are you doing this? Yes, no, those sorts of things. Pretty soon we collected quite a bit of data, like over 50 offices that we had been into. So looking at that aggregate data, I think the biggest opportunity for offices is increasing their ability to do audit and feedback.
Okay. Interesting.
Yeah.
Like self-audit.
Yeah.
Okay.
Yeah. And providing feedback to the employees.
Yes. Yeah. Oh, gotcha. So it's their own ability to kind of understand where they are in their own system, what's failing, what's not failing. Okay. Interesting.
Yeah. And then how to improve.
That's the exact next question is how do they improve? So they do this self-audit. They're like, okay, we see some gaps. What would you advise them to do next in terms of how they close the gaps?
So I'll say every facility I've ever been in has gaps. We all have gaps. We're human, right? To err is human.
Yeah.
I think the most difficult part of it is you have this list of gaps and it looks overwhelming. So just start with one thing.
Yeah.
And make that one thing a little bit better. And then you can kind of go down the list and pretty soon you've made everything a little bit better.
Yeah. One of the things that you're such a huge advocate for is allowing dental assistants to have ownership in this particular process and like the identifying of the gaps, feeling empowered to mitigate those gaps. Tell me a little bit about the importance of maybe having a particular role. We call it the infection control coordinator.
Yeah.
Going to a dental assistant and what that does to them, what that does for the office in terms of how they take ownership on infection control.
Having an infection control coordinator is a fantastic way for an office to be a step above. I actually did a survey that hopefully will be published here soon.
Nice.
All right. If I can get some other people to get motivated.
Yeah.
But we found that there is statistical significance in having an infection control coordinator in your office and compliance rates.
Okay. Tell me more.
So we did this survey. There were about 400 dental professionals that took it. And those that self-reported that they were an infection control coordinator had higher compliance rates in this whole list of things we asked them about. So just across the board in every infection control domain, they were doing better.
Yeah. Awesome. Tell me a little bit about your own journey with dental assisting and education, kind of the marrying of those two things, because that's also something you're a massive advocate for.
Absolutely. Just in general, I am a lifelong learner. I love to learn things. Everyone always jokes and is like, when are you going to go get your PhD?
Yeah.
But that's a lot of money that I don't have. So
but you're thinking about it. It's in the back of your mind.
It is in the back of my mind. Yes, absolutely. But who knows? Maybe someday I'll be Dr. Stream. But there's always an opportunity for us to learn, no matter what space we're in.
Yeah.
So I think for dental assistants, oftentimes they aren't given the opportunity for those educational moments.
Yeah.
But I think being a self-advocate as a dental assistant and saying, I want to learn more about this.
Yeah.
I want you to support me in my educational journey so I can become a better employee and I can support our patients better and I can make this a safer office.
Yeah. Yeah. That's great. What's a good place to start?
Oh, a good place to start is just asking the questions.
Yeah. Tell me a little bit about your role with Danby specifically.
Yeah. So recently hired on as the education product manager for
Yeah.
Danby. So I am overseeing all of their continuing education products.
Mm,
So updating and new courses and
yeah.
all of those fun
Yeah.
things.
Yeah. This is a shameless plug for Danby and for
Yes.
you
Yes.
in terms of making that connection and that education easy for dental assistants. So for a dental assistant, maybe that's getting the chance to be empowered to learn more. How is Danby helping support that?
So there are a lot of educational opportunities through Danby. We do a lot of online continuing education. There's a lot of online exam prep
Mm. Oh, cool.
resources.
Yeah.
So Danby does credentialing for dental assistants. So you could become a CDA. There are a lot of different state credentials that you could get.
Mm.
There's the infection control
Yeah.
certification, the CDIPC. So, and it kind of depends for dental assistants what's going on in your state on
Okay.
what your minimum education needs to be.
Okay. So tell me a little bit more about that.
So every state is different in what they require.
Mm.
So some don't require anything.
Okay.
You could work at a gas station one day and be a dental assistant the next day,
Sure.
which is a little bit frightening
Sure.
as
Yeah.
far as like
Yeah.
standard of care goes. There are some states that are more strict in that. Some require you to be a Danby
Mm.
certified dental assistant or to take state boards to be
Mm.
able to practice. So it just depends on where you live, what those
Yeah.
requirements are.
Yeah. Yeah. One of the other components of that I've seen you advocate for kind of time and time again with dental assistants specifically is that idea of leadership. You've gone what was the specific leadership program that you were a part of that was so fascinating to me?
Yeah, I'm in the Great Plains Leadership
That's
Institute.
right.
Yeah.
Yes. Tell me about that. That's so interesting.
Yeah. So that is actually a public health leadership
Hey.
opportunity.
Hmm.
So they bring together multiple public health professionals and it's a year-long program. So I'm
Cool.
about 2/3 of the way done
Nice.
right now.
Okay.
Graduate in October.
Wow. All right. So it's coming
Yeah,
up quick.
It is. It is. Yeah. But that has been a really cool experience.
Yeah.
And it like leadership is a weird thing.
Yeah. Why?
So I never thought of myself as a leader.
Mm.
And so when I applied to be in the Leadership Institute, I was like, I want to learn more about this.
Mm.
And, maybe someday I can be a manager or, whatever.
Yeah.
But what I've learned so far is that anybody and everybody can be a leader. It's not necessarily a title or a role that you're put into. And now that I've stepped back and done a lot of self-reflection,
Yeah.
I kind of feel like, well, maybe I am a leader in the industry or, for dental assistants and just kind of speaking up for education and safe practice.
So cool.
So,
What are some of the key highlights there that you've learned from the Institute as you've gone throughout the program?
I think the hardest thing for me was the self-reflection part. Like,
seeing yourself as that person.
well, seeing yourself and your self-behaviors and how you interact with others.
Okay.
So we did a lot of like the MBTI testing where you look at your personality types.
Mhm.
We did 3 or 4 of those
Okay.
types of tests. And then it was really funny because the whole group would get together. I think there are 20-ish of us, and everybody is in a different space, personality-wise. So they would like line us up on a scale and be like, all right, tell me about how you would work with this person.
Oh, interesting.
Yeah, like
okay.
I'm very introverted and quiet.
Mm.
So like on a big group meeting, I won't say anything. But then there are the people that are very extroverted
Yeah.
who like to talk a lot.
Yeah.
And, just understanding that that's their personality and, me giving them the space to talk about whatever they need to, but then also them giving me the space
Yeah.
to speak up if I need to.
Yeah. That advocacy piece, that finding your voice is so powerful. How do you think that correlates to dental assistants? And why would you advocate for dental assistants to pursue potentially the idea of leadership? How could that benefit them? How could that benefit the office?
Well, I think everybody has the opportunity to be a leader. whether it's at home or in your office or in whatever other space you're in. I think that oftentimes dental assistants feel like they can't speak up. And I've been in that position.
Yeah.
Like, I'm the newbie in the office. I'm the low man on the totem pole. Nobody's going to listen to what I say. But that also plays a big role in safety, right? Like, see something, say something.
Yeah.
But I've also been in that situation where, like, I see something and I know it's not right, but then nobody's going to listen to me. So, like, it's a really tough position to be in.
Yeah.
And I think that the leadership in dental offices could be better as far as like that safety culture goes. Like everyone's voice should be heard.
Yeah. How do you think that's cultivated? How do we create that space for people to feel safe to have those kind of conversations?
I think it's got to start from the top down.
Okay.
It does.
Yeah.
Because if you have an owner or maybe your corporate or whatever, if they are not on board, it will never happen.
That's tough.
But it's a reality
it's a reality of culture.
Yeah.
Are DSOs changing that? How is that impacting culture? Specifically as it relates to being able to communicate things, moving up the chain and things that you're seeing.
Yeah, I think that some of them are.
Okay.
I've interacted with a few DSOs that are doing a really great job of that, that are promoting that safety culture.
Yeah.
And, everyone has a voice and no question is too dumb. And so I think in that space, it's probably a little bit easier than even in private practice.
Really?
Yeah.
Oh, okay. Tell me more about that.
Well, so I feel like I'm picking on the dentist, but
okay.
I've seen a lot of situations where the dentist is very production driven.
Sure.
And which it's a small business. I totally get it.
Yeah.
We need to have that mindset, but safety also is important.
Yeah.
So that also needs to be at the top of the list. But maybe they were trained a few years ago, things have changed, but they're not open to change.
Yeah.
They're doing things like let's do what we've always done because it's worked.
Legacy.
Yes,
yeah, we've heard
those
that a
legacy
bunch.
errors.
Legacy errors.
But I think those owner dentists need to be able to embrace change for the better. I think some of them feel like they're doing something wrong. And that's absolutely not the case. Like, things change.
Yeah.
And that's okay.
Yeah.
Technology changes.
Totally.
Safety changes. But you need to be able to embrace the change and hear everyone's voices.
Yeah. And you're seeing DSOs potentially cultivating that space a little bit more efficiently or effectively.
Yeah.
Yeah. That's so interesting. Going back a little bit to your journey as a dental assistant and then getting into education and now where you are today, as you look back and you reflect, what are some of the things that are key highlighted moments that you'd say to any dental assistant, you should do this? Like as you looked in reflection, you're like, these are the things I wish every dental assistant would do.
That's a tough question.
That's a big question.
I think the first thing, if I was looking back on myself when I first started, I think the first thing that I would tell myself is to speak up for what you want.
That advocacy piece.
Yes.
I love that. Okay. Yeah.
Which is not in my nature. I'm that introverted person. I want to make everybody happy.
Yeah.
And as I look back on like my first clinical position, we were doing a lot of things wrong in infection control. And I didn't know any better.
Right.
And that's okay.
Yeah.
But there's always an opportunity for more efficiency. There's always an opportunity for better processes.
Yeah.
So if you see some of those things, speak up about it. And sometimes you have to appeal to whatever is driving that owner dentist, right?
Yeah.
Like we could make this process more efficient and maybe save a little bit of money.
Sure. Yeah.
But as well, we are making the practice safer for our patients.
So great. Tell me a little bit about a story of maybe a DA that you've consulted with that's now really leading the way for infection control as it relates to the office.
Yeah. So I've worked with a lot of great dental assistants, but there's one, she's become a really great friend over the years. She is actually the safety coordinator now for multiple offices and has worked her way up because she's just so passionate about infection control. And she's still she'll still text me questions, and they're I think to anybody else, the questions would seem super nitpicky.
Yeah.
But that's what makes a good infection control leader, is looking at those nitpicky things.
So cool.
So she's asking those nitpicky questions, but then she's doing something about them. So not only asking the question, but then the follow-up. They had an issue where their hand pieces were leaking oil and contaminating the packaging, right? Couldn't figure it out. We worked on this issue for over a year.
Yeah.
Still can't figure it out. But she never gave up. She contacted manufacturers and experts and did all the right things to make sure that their office was doing things correctly.
That's great.
Yeah.
Yeah. Kudos to her. That's awesome.
For sure.
And then going even further back to the data piece, I'd love to come back to that because you're so knowledgeable there. And I don't want to skip over that in this particular time. So what are some of the other things that you've seen that maybe surprise you as you've done some of the research, you've done some of the audits? You're like, okay, I didn't think we were here, but here we are. This is what the data is saying. And how can we learn from that?
Oh, gosh. So I think one of the things that surprised me, and this is really a very specific piece of data, but a majority of offices are not disinfecting anesthetic carpules before they load a syringe.
Okay.
Which I never even thought of before I was an infection preventionist, right? You open the box of carpules and you take them and you load the syringe.
Yeah.
But it really is, it's a medication vial and they're not packaged sterile. So, and I know people will put them in their pocket of their lab coat and carry them around and then use them, or they lay in a drawer or whatever. So best practice is to wipe it with an alcohol gauze before you load the syringe.
Yeah. More you know.
Yeah, that's right.
This is awesome. I'm curious on your thoughts with the next generation of dental assistants that are coming in, how they're learning differently, how they're showing up differently. I'm assuming with some of the stuff you're doing at Danby, you're starting to see some of that now. The way that this next generation is coming in is very different. What are some of your insights into that?
Well, I think this is across the entire education space.
Yeah.
The newer generation wants more focused and targeted, micro learning opportunities.
Okay. Interesting.
Yeah. So shorter snippets, instead of doing a 12-hour long course on whatever online, which with a lot of reading, maybe just real short videos and knowledge checks in between, and really focusing on that micro learning part of things.
Yeah. I genuinely, I don't know. Is community such a big part for this next generation? Do they like learning collectively, or are they totally okay with kind of their micro learning on their own pace and time?
I feel like it's more of an independent thing.
Yeah. Okay.
Yeah. And you can really see some of that when you look at association membership numbers. A lot of the membership associations are declining.
Oh, interesting.
Yeah.
Okay.
So there's not as many in-person meetings.
Yeah.
And, even the state level association membership is declining.
Yeah.
So a lot of that community, I think, is going away and being replaced by that independent learning.
Wow, that's so interesting. How is Danby responding to that? So are you creating now a lot of more micro level trainings to accommodate the next generation?
So that's in the talks.
Okay.
In the works.
Yeah.
And we're looking at some different technologies potentially, different learning platforms.
Yeah.
To help facilitate that.
Yeah, that's so interesting.
Yeah.
When they move into the workplace, okay, and you have this whole new generation of dental assistants, how do you think that's going to change dentistry for the better? Like, what are they bringing to the table that's going to challenge the status quo?
Technology.
Okay, yeah.
Yeah, for sure. Digital dentistry is becoming huge.
And what does
So
that specifically mean?
So digital dentistry is like moving away from the traditional impression, sending
Mm,
it to the lab, having the lab fabricate
okay,
a
yeah,
denture or
yeah.
PFM crown or whatever, and really moving it all in-house. So digital
Wow.
impressions, designing crowns in-house, 3D printing and milling,
Yeah.
and everything is done there. And really the dental assistants are taking on a lot of those roles.
Wow, really? Okay,
Mhm.
that's so fascinating because they're so tech savvy already.
Yeah.
And this next generation is going to be even more so. That's so fascinating. I feel like you're the only person I've ever asked this question to so far in our guests. So this is totally off script, but I'm excited to ask it. For you specifically, where do you think AI plays a role in all of
Oh god.
this? Have you already, I'm sure you've already been thinking about this because you're so data driven.
Um I think that AI will play a big role in a lot
Mm,
of different spaces.
yeah.
So, like right now, AI is in some of the radiology software
Mm,
space,
yeah.
and I've seen really good things there. I'm sure it will get into digital dentistry,
Yeah.
and you know, I'm sure we can have AI designed crowns or dentures or
That's
whatever that
crazy.
can speed up that process even more.
Mm,
In education, it's becoming a thing.
yeah.
I honestly, I feel bad for some of the educators out there now, like traditional educators
Mm,
in some of the programs because students are now using AI to write
totally.
papers or,
For sure.
whatever.
Yeah.
So that's something that is happening.
Yeah. I feel like that's even like my own personal life. I feel like that's kind of how I'm starting to learn. It's no longer like the Google search, it's like the ChatGPT inquiry. Like a
Yeah.
very different way of looking for information and gathering information.
Yeah, and you have to be careful
For sure.
with that.
Yeah.
I will say that ADS, Association for Dental Safety, just
Mm,
released their Ask ADS tool, which
yeah.
is AI, but it's a closed AI system.
Okay.
So
Which means,
that means that they feed it only the resources that they want it to look through.
gotcha. Okay.
So it's all vetted resources. It doesn't go out and do a Google search,
Yeah.
right? Like ChatGPT would.
Right. Right.
So I think there's a lot of opportunity for AI in that way
Yeah.
to make it more reliable.
Mm.
But at one time, if you asked Google how many rocks you're supposed to eat a day, it would tell you one was the healthy
Yeah.
limit.
Oh, Google, we've come so far. That's cool.
So
I love the closed system idea, and I
yeah.
love that ADS is doing that so that you're getting filtered content that you know is already peer reviewed and kind of vetted already, which is such a great way to
Yeah.
learn.
Well, and the cool thing about the AI is like if you ask it a question in Spanish, it will answer in Spanish.
Mm. Oh, cool.
Yeah.
Yeah. Wow. Yeah, it's gonna change the landscape for sure, and it's exciting to see where that goes. Sarah, I'm curious, how can people keep in touch with you? What are you up to? What's going on that people can find you or follow you?
Oh gosh. So honestly, I've been off social media recently, which has been
Okay.
fantastic.
Yeah.
Just with everything that's going on in the world, it
Mm,
helps my stress levels.
yeah, that's great.
But you can find me on Facebook, just Sarah Stream.
Mm,
Um, I have a consulting business, so Stream Education and Consulting.
yeah, yeah.
Um, Check out my website. Probably needs updated, but that's okay. And then I'm around.
You're around.
I speak and
Yeah,
do fun things like this. So
yeah. Were you at Under One Roof?
I was
I
not
knew
at
you were
under.
at
Yeah.
ADS. Yeah, yeah. You're a rock star at ADS, which is fun to see you there. I do have one last question, and then we'll
Sure.
wrap, which is tell me a little bit of an opportunity to tell the audience about what you do specifically now with your consulting.
So I do a lot of speaking with my
Mm,
consulting. Um, I was doing like the OSHA HIPAA training thing,
yeah,
but that in itself could be a full-time job. So it's hard to do that while
yeah.
I'm
It's a
also
balance.
working full-time. But honestly, I'm just happy to be a resource for people.
Mm,
Um, if people have questions, shoot me a Facebook Messenger. Like, ask me your
yeah,
questions because I want to get you the right information. instead of going out to Google and ChatGPT and finding something that's totally off the wall and not correct. So I'm always happy. Shoot me an email, ask me the questions.
Yeah, that's awesome.
I have a group of friends, and like they tell me I'm the librarian. They'll be like, I need a resource for this. Where is it at? And usually I can find it within a couple minutes.
Yeah. That's awesome. Well, thank you, Sarah, for being on the Safer Together podcast.
Yeah,
Appreciate you coming
thank you.
out.
It's been fun.
Yeah, this has been great.